A 65-year-old patient is newly diagnosed with diabetes mellitus. His hemoglobin A1c was tested and it was 12%. He was put on an intensive regimen to control sugars. After a month, he started complaining of severe neuropathic pain in both distal parts of the limbs, and postural hypotension was recorded. In view of suspicion of the neuropathy, nerve conduction study was conducted, which was normal. Now coming to what this situation is. A possibility of distal sensory neuropathy due to diabetes mellitus. To be considered that this is the most common variety of the neuropathy which is seen in the diabetes. It is a variety of axonopathy and it can present with the severe pain. However, when we will do the nerve conduction studies, it would reveal changes, and usually it happens gradually over the period of time. Now, about the treatment induced neuropathy of diabetes, which is an entity when we rapidly correct the diabetes can be seen, especially if the hemoglobin A1c is corrected more than 2% within 3 months. There is a higher incidence of treatment induced neuropathy. That is a variety of basically a small fiber neuropathy and can present with the severe pain in the distal parts of the limbs and can have the autonomic features. Now, as far as the management of this disease is considered, permissible hypoglycemia is not a suggestion to be done. So, it is not advisable to relax the tight blood sugar control. What should be done is that to prevent this entity, the blood sugar should be lowered gradually. Later on, it would be need as usual blood sugar control as in any other patient. However, we should not reduce the blood sugar more than hemoglobin A1c, especially more than 2% within 3 months. Now, treatment with medication for neuropathic pain is effective or not in these cases. So, we can see from the above history that probably this is a treatment induced neuropathy, which is a small fiber variety, and it is in the initial stages, it is usually refractory to the medicines used for the neuropathic pain. However, with the time, the patient improves and gradually his symptoms subside, and we have to maintain the effective blood sugar level. Now, coming to the whether autonomic neuropathy is seen in the treatment induced neuropathy of diabetes or not, yes, it is seen. Basically, this variety of the neuropathy consists of the small fiber neuropathy involving the fibers which are carrying pain and temperature, and the autonomic. Also, the sensations are also carried by these fibers. So yes, autonomic neuropathy is seen in the treatment induced neuropathy of diabetes. So that should be the answer. Thanks.